All right, we'll just get started. But thanks, guys, for joining us. Happy Tuesday. I'm here with my colleagues, Tyler, who you guys know, and special guest Matt Cohen, our Chief Program Officer. But our very, very special guest today is Dr. Beth Lannon. And I'm not sure if any of you or all of you have met her, but Dr. Beth Lannon is our clinical director for Healthy Hearing in Northern California. She is also a global clinical advisor for Special Olympics International and one of the, I'm going to call her a founding member of the Healthy Athletes Program. She works professionally for John Muir Hospital and Stanford Children's in their development department, but today she's here to talk to us about healthy hearing and how you guys can improve that while we are all at home. So if you have any questions for her, use the chat function, but we will also have some Q&A time at the end too. So if you have a question at that point, we'll just raise your hand and I'll unmute you. And maybe if your name isn't updated in your little box, I'll try my best to rename you, but try to do that yourself too if you can. Okay, anything I'm forgetting, Tyler?
Have fun.
Okay, all right. Dr. Lannon, I will turn it over to you, and then I can start your presentation in a moment.
Okay, yeah, you can just put it up. Hi, guys. Okay. Thank you for taking the time today to talk with me. I'm really happy to be here, and I did some slides. And as Amanda said, I'm just going to talk to you about healthy athletes and healthy hearing and what we do and some things for you to think about when you're at home about your hearing. And if you have questions, just raise your hand and you can either type them in or you can ask the question at the end. Okay, you can go to the next slide. Okay, so I think all of you already know this, but Special Olympics has a special program called Healthy Athletes, and there's all different parts to the Healthy Athletes program. There's hearing, which I'm going to talk to you about today, and hopefully if you have questions, I can answer those questions for you. Vision, where we check your eyes. Dental, to see if you have any issues or problems with your teeth. Feet. Fitness, you know, how you stretch and how you work before you're doing your sports event. Health promotion, and strong minds. Okay, next slide. Okay, so I am part of Healthy Hearing. And the question that I want to answer for you when you go to an event or when you talk to your doctor is, how do I know if I need to have a hearing test? And I'm going to give you some pointers or some tips to help you answer that question. Okay, next slide. So, you need to have a hearing test, or you need to talk to your doctor about getting a hearing test if you have a hard time hearing. So when you talk to people, you have to ask them to repeat themselves or say things over and over again. Maybe you have a hearing loss. If you have a hard time hearing, if there's a lot of noise in the background, so if you're at a restaurant or even a sporting event and there's a lot of noise in the background, does that make it more difficult for you to hear? Or are you not able to hear at all? Okay. Next slide. If you can't hear people clearly, so maybe you know someone is talking and they're saying something to you, but you can't quite understand what they're saying. Or, and this you might notice now that everyone has had to stay home, if you have to have your music or the TV louder than other people that are in the room with you. So if when they turn the volume up, they can hear it, but you can't, that might be a sign that you need to have your hearing checked. Next slide. If when you are talking to people, you get really tired because you have to pay attention, listening is really hard for you and you have to keep concentrating, and by the end of the day, you're just exhausted because you've had to listen so hard, that might mean that you need to have your hearing checked, or you need to talk to your doctor about having your hearing checked. Next slide. Okay, another reason to talk to your doctor, especially if you have ear pain, if your ears hurt you, your ears should not hurt, but if your ears hurt you, you need to talk to your doctor. If you have stuff, drainage or liquid or pus or something coming out of your ears, you need to talk to your doctor because something isn't right. You might have an ear infection. And also, if you get dizzy, if you stand up and your head is spinning, or all of a sudden you feel dizzy, sometimes that dizziness is related to problems that you may be having with your ears. Okay, next slide. So there's all different kinds of hearing loss. There's hearing loss that's temporary. So that means you could get it and then it would go away. So some of the things that cause temporary hearing loss, actually, can you go back one slide? Oh. Okay. Some of the things that can cause temporary hearing loss is wax in your ears. Everybody has wax. Wax in your ears prevents any damage to your eardrum or the inner part of your ear. And it's kind of like a little antibiotic, but too much wax can block your ear and prevent you from hearing. And you can take care of this cleaning your own ears. But the first thing is don't use Q-tips. And you can see from this picture, you should not use Q-tips to clean your ears. And the reason for that is that when you use the Q-tip, it ends up pushing the wax in further. And it goes further into your ear canal, deeper into your ear, and it's really hard for it to come out. The other reason is that the Q-tip has cotton on the end, and little bits of pieces of that cotton mixes in with the wax and dries out the wax and makes it really stuck in there, so that you need to have a doctor take that wax out so that you don't hurt yourself. So if you don't use Q-tips, how do you clean your ears? Basically, you clean it with a washcloth, a warm washcloth, warm water in the washcloth. When you take a shower and wash your hair, you want to let some of that water drain in your ear. It keeps the wax nice and soft. And when you chew, the wax will work its way out on its own. So you don't have to do anything to pull that wax out. If you have a lot of wax, or your ears are very small, so it's hard for the wax to come out, you can use drops, and those drops you can just get over the counter. Don't use alcohol, don't use oil, don't use, some people use candle wax to take wax out of their ear. Don't do that because you may burn yourself. Just a warm washcloth or drops that you can get at the pharmacy or at the drugstore, and you can drop it in your ear at night, and it'll keep the wax soft, and the wax will work its way out on its own. So again, everybody has wax. Wax is normal. Some wax is normal. You just don't want to get a whole bunch in there so that it causes you not to hear. Okay? Once that wax comes out, your hearing should go back to normal. You should be able to hear fine. Okay? Next slide. Another temporary hearing loss can be from an ear infection. If you have an ear infection, you may experience or you may have some pain in your ear or on your jaw or on your cheek. If you have that pain or you have drainage coming out of your ear, you really need to see your doctor because you need medication to help that infection go away. While you have that infection, you may have hearing loss. Once that infection goes away, your hearing should go back to normal. You should notice a difference. But you need to see the doctor about what kinds of medication you should use to make that ear infection go away and have your hearing go back to normal. Okay, next slide. The next kind of hearing loss is the permanent kind. And this is the kind that no matter what you do with the doctor, your hearing is not going to get better, okay? And that can happen because of your age. As we get older, our hearing changes. Or you could get hearing loss if you have a lot of loud noises over long periods of time. So if you're using earbuds or earphones to listen to music or the TV, you want to make sure that the volume is down low enough so that you're not causing that permanent damage to your hearing. So if you are getting older, like me, you definitely want to have your hearing checked and talk to your doctor about having your hearing checked at least every couple of years, or come to a Healthy Athletes event and have your hearing checked every couple of years. And you want to make sure that if you are using earphones or earbuds, that you keep the volume soft enough so that someone who doesn't have the earbuds on or the earphones on isn't able to hear what you're hearing. If they can hear what you're hearing, it's too loud. Next slide. If you wake up one day and all of a sudden you notice you have a hearing loss, you went to bed the night before and everything was fine, but then you woke up in the morning and you couldn't hear, or things were muffled, or you didn't understand what people were saying. If you have ringing or buzzing in your ears, like a loud, high-pitched screech, and that happens suddenly, if you suddenly have ear pain or dizziness, that might mean that you have something medical that needs to be seen by your doctor right away. So make sure you tell someone and call your doctor and let them know that you're having these symptoms so they can have you come in and check you out. Next slide. So at Healthy Hearing, some of the things that we do to make sure that you don't have wax in your ears, don't have an ear infection, and that your hearing is good and you don't have a permanent hearing loss. The first thing we do, and you can see in that top picture, is we use a special light where we look in your ear to make sure that there's not a lot of wax or there isn't something else in your ear canal that should not be there. We also check to make sure that we don't see any drainage and that your eardrum looks nice and healthy. The next thing we do is a hearing test, and I think some of you may, when you were in school and you were younger, probably had the hearing test where you wear some earphones and you listen to some beeping sounds, and then you just either raise your hand or you say, yes, you heard those tones. So that's a test that we use to check to see if in fact you do have a hearing loss or not. And then the third thing is we check the middle ear And this is a pressure test to make sure that you have no ear infection, so that there's no fluid in your ear that you need to see a doctor about and get some medication. If you don't pass any one of these 3 tests, then we would recommend you go and see your doctor and have it checked out, have your ears checked out. So basically that's healthy hearing, and that's kind of what we do to make sure that your hearing is good so you can hear your coaches, good so you can hear your teammates, and good so that you can do your job and work and live with your families and hear what's going on around you. So now I'll just open it up. If anyone has any questions or anything they want to talk to me about, I can talk to you. Maybe if you raise your hand, if you've ever gone through healthy hearing. Yeah, and how was that? Can you tell me how that was?
Let's see. I'm gonna unmute Steph. I think Steph has been through healthy hearing.
Hi,
I did.
Steph.
Hi. Hi, Beth. How you doing?
Good. How are you?
Good.
Good.
I have doing all that stuff. I have.
Good. And how was it?
My ears is totally closed. Crystally closed. When I was 6 years old, I didn't start swimming, but I still have I got 2 infections in my ears before.
Yeah.
I have that. But I had surgeries for both of my ears when I was young. I didn't feel any pain.
Good.
And then one of them just fell my tooth is right through my brain right now. But I can't get it out yet. But most of them I just did. Only one stay away from underneath the water.
Yeah.
Because sometimes I can't get through because my ears cannot handle it.
Yeah.
But actually, I still have my 4 sets of my earplugs with me, and
Good.
including my solution.
Great. So that's a really, really good point. For those of you who swim, sometimes water from the pool or the ocean
Yes,
get
yes.
in your ears, and that can cause an infection. And
It
so
does.
there are swim plugs or plugs that you can put in your ears to prevent the water
You can
from
get
getting
them
in
at
there.
Amazon, so that's what you need to do.
Yep, you can get them at Amazon, and sometimes at the healthy hearing events, we can take a mold or an impression of your ear.
You can just ask you can just ask the swimming instructor. Say, I cannot hear you. Then would you please speak up a little bit louder for me? Then I can understand then all the swim strokes.
Excellent.
How long do you have been doing this?
I started with healthy athletes in Southern California about 20 years ago. 20. I can't believe it.
That's good.
And then I've been doing it, Amanda, maybe 3 or 4 years now in Northern California.
Yes.
The other thing that I do with healthy hearing is I go to the World Games and I train people from other countries to know
What
how.
other countries do you go to?
I've been to, let's see, I've been to Greece. I've been
there.
to China. I went to Jamaica.
Wow.
I went to almost every state in the US. India. I went to India one time.
That's good.
Yeah. So I train other people to go back to their countries so they can do healthy hearing for their athletes.
I actually I've been going to around the world because I am collecting all my traveling shot glasses around the world.
Oh, shot glasses.
Yeah, shot glass where you
Cool.
went to. I went to a lot of places.
Yeah.
Okay, Steph, we can talk about that later, but we have a lot of other
Yeah,
questions in this.
that's
I
So
think
thank you.
Did Amber
Okay.
raise her hand?
Yes, so I'm gonna unmute Amber, but we also have Sophie, Sandra, Melinda, I think had a question. So we'll all have our time. Okay,
Okay.
go ahead, Amber.
Hi, Amanda.
Hi.
Hi, Amber.
Hi. So I heard Amanda say that you work in a hospital.
Yep.
How's that like?
I like it a lot. I oversee pediatrics.
Mhm.
And so sometimes it's hard because it's not nice to see young kids getting sick. But it's also very rewarding because when they get better, they get to go home with their family.
Yeah, and also I've been having hearing tests ever since elementary school. And they're like,
And how is your hearing?
good.
Good.
No, you're supposed to say what?
That's my dad. That's my dad.
Awesome.
That's my dad.
Okay.
Thank
All
you.
right. Thanks, Amber. Okay, Sophie, I think you're next.
Hi,
Hiya, Beth.
Sophie. Hi.
Hi. So I've
I'm
actually
fine.
had
How
help
are
with.
you?
I'm good. Thanks. Anyway, I've had healthy hearing before as well. From high school to lately, I've been having hearing tests, and they've been saying, can you raise your hand if you can hear this beep? We're gonna
Yep.
tell you beep, and you raise your hand from that
Yep.
point. You know, it's
Yep.
very useful.
Yep. And we make the beeps very soft. We make it tricky for you.
Yeah. So one question: when you're giving a hearing test, is it possible if you can play the beeps, but can you make it a little bit trickier? Just a tiny bit, but not too much. Maybe just a tiny bit.
I didn't hear you. Make them what?
Make them a little bit trickier, but not too much. Just a little trickier.
I think
We
she's
can
maybe
do
talking
that.
about, yeah.
We can make them very, very soft. That's how we know if you can hear it or not.
Great. Thank you.
Okay. Thank you.
Thanks, Sophie.
One second, you guys.
Okay, I think Sandra, you have a question? And then Melinda, then JJ.
Hi,
Hi, Sandra, what's
Hi.
up?
what's up?
You have
Well, for me, I went to the Spain Valley hospital so the doctor can check my ears, and it also took the earwax out of my ears too.
And did that make you hear better?
Yeah, they made both of my ears hear better. Yeah.
Good. Good.
Is that with the loud volume on my phone and with my headset? I couldn't hear my mom, so I had to pause my music and so I can hear her what she's saying.
Yep, that's exactly what you need to do. You need to make sure it's not too loud because that can cause permanent damage to your hearing.
Yeah. And I have a question. How long you been doing the hearing thing?
So with Special Olympics, I've been doing it 20 years, but at the hospital, I've been doing it, you ready for this?
Mm.
44 years.
Whoa.
I'm old.
Well, thank you.
You're welcome.
Thanks, Sandra.
You're welcome.
Okay, I'm gonna unmute Melinda. Hi,
Hi,
Melinda.
hi, Amanda.
Melinda.
I did the healthy athletes too.
Oh, good.
Mm-hmm.
And did you have your hearing tested?
Yes,
And how was it?
it's healthy. My ears are healthy.
Good,
Mm-hmm.
good. We hope to see you again
Okay.
next time when we can do an event. We hope to see you.
Okay.
Thanks, Melinda. I like your stuffed animal.
I know, that's so cute.
Mm-hmm.
Okay.
I
All
think
right.
Ellen.
Oh, I'm going to do JJ first and then I'll do
Okay.
Ellen.
Okay.
Ready, JJ?
Hi guys.
Hi.
I went to the healthy athlete checking the ears thing, and how long you have to clean your ears?
I would say probably a couple of times a month. Just make sure when you are washing your hair, you let the water go in there and then just use a warm washcloth to just gently go in around your ears. When you
Okay.
chew
Mm-hmm.
like that, it causes the wax to just work its way out. So it'll come out naturally.
Oh,
As
okay.
long as you keep it nice and soft.
Yeah, cause I don't like loud music, that's why I'm trying to turn down my volume music for my phone because I can't hear my mom or my uncle
Right.
the whole time.
Yep. You
So,
want to
yeah.
keep that volume low enough that other people can't, excuse me, around you can't hear that.
Yeah, because I was little, I was swimming in the ocean and the water stuck in my ears, and then I went to the hospital, and then they took the water out of my ears, all of it. Like,
Yep. Yep. You had an ear infection. Yep.
yeah, I
Yeah.
did. All right, thanks.
Thanks, JJ.
You're welcome.
Okay, I think you said Ellen. So we have Ellen. I see you, Maurice. I see you, Caroline. Stephanie Ashby. And then we've got some in the chat too. So I don't know where Ellen went. Do you see her, Kyle? I mean, Tyler.
Yep. I see Ellen. Half of
There we go.
Ellen.
Okay.
Well, you know, Beth, I am a healthy athlete because I do a lot of sports every year.
Great.
And I've been checking with my doctor every year.
Have you come to Healthy Hearing at the sporting events?
Yes.
Good.
Ask a question. Beth.
Hey, doctor,
Yep.
I got a question.
Sure.
How come, how come, how come that my ear keeps itching once in a while?
Okay, that could be because some wax is in there and it's dry. Is any other part of your skin dry?
No.
Okay, sometimes if your ear gets dry, the skin will get flaky in there and that's why it itches. So again, when you wash your hair or shower, just let a little warm water go in there, okay?
Okay. Thank you.
You're welcome.
Thank you, doctor.
You're welcome.
Thanks, Ellen. Okay, I think I said, let me do Caroline. Caroline, are you there?
There are the pieces over there, Dad.
Hi, Caroline.
Hi, Amanda.
Do you have a question?
Yeah, if I have mild loss of hearing in my right ear.
You have
And I can-
mild hearing loss in your right ear.
Yeah,
Have you ever worn a hearing aid?
yeah, I did.
Yeah. Do you have one now?
Yeah, I have a hearing aid.
And how does that help?
Helps really good.
Yeah. What about your other ear?
I can hear fine in this one, the left ear.
Good. Good. How often do you get your hearing tested?
I had it tested with Dr. Bruce, with one of the hearing doctors that I see, Dr. Bruce.
And so you go, what, once a year?
One.
Caroline?
Once I do once every
year?
once in a while.
Yeah, so if you have a hearing loss and you wear a hearing aid, it's a good idea to go and see your doctor every year.
Okay.
Just to make sure everything is okay and it hasn't changed and that the hearing aid is working, okay?
Okay. Okay.
Okay.
Okay, thanks, Caroline. All right, Maurice, I'm gonna unmute you. Hi, Maurice.
Hi, Amanda.
How are you?
Hi.
Good. Hey, Beth. I got some questions. What is it good for you? What is it good for you to go to sleep if you don't want to hear any noise?
They have little earplugs that you can get in the pharmacy. They're like sponge, and you just squeeze them tight and then just gently put them in on the end of your ear. That will make it so that you can't hear. Or you can put your radio or music on, but have it make like a static noise or an ocean noise. That will help keep you quiet and you'll be able to sleep.
Okay, because I got these little earplugs today.
Yep.
Yeah.
And do they work?
Yeah. They help me sleep a little bit.
Good.
Yeah. And I always go to my doctor at Kaiser, and he checks in my ears to check a little wax, and if it's a little too much, then they put a little warm water, and they till it's all out.
Right. Right. If you put a little warm water in your ear, you want to make sure that it all comes out so that your ear is nice and dry.
Yeah.
Yep. You're right.
Yeah. And I don't want to. Whenever I want to listen to my music, I want to don't want to maximize the volume. You want to get at the right volume if you want to hear.
Right. And you don't want to use Q-tips. Okay? You don't want to use Q-tips to put in your ear. Okay?
So I need to go to a pharmacy and look for something to put in the ears and.
Those drops are if you have a lot of wax and it's very dry. But if you just have a little bit, you can do that in the shower.
Oh, okay.
Okay.
All right, I'll give it a shot.
Okay.
All right.
Thanks, Maurice.
Thank you.
Thank you.
All right, I think Sierra had a question. Hi, Sierra.
Hi, Sierra.
Hi. Do you have a question? How are you doing today?
Good. I have a question about something. If you put Q-tips all the way down your eardrum, what happens?
If you what?
Put a Q-tip down your eardrum.
If you put a Q-tip in your ear and you put it too far in, you can make a hole in your eardrum, and it's very, very painful. The other thing is by putting a Q-tip in your ear, it doesn't usually get the wax out. It just pushes it in deeper, and then it makes it really hard to get it out. Q-tips aren't made for the inside of your ear, only the outside.
Can you get sick from it?
Well, if you push that Q-tip in deep enough, it hurts. It hurts a lot. And if you break through your eardrum, you might see some blood. Okay? Okay.
Good question. Thanks, Sierra. Okay. Tommy, you are next, then Kyle.
Hi, Tommy.
He's on mute. Oh, there we go.
Yeah.
When you have wax in your ear, does can you use eardrops?
You can use eardrops, but you need to get the eardrops at the pharmacy, okay? Because
Okay.
it's a special solution that will soften the wax.
Because for me, I can't. Well, for me, I would use a Q-tip, or I would use a paper towel.
Yeah, if you're gonna use something, use a paper towel just to wipe your ear. You don't want to put anything in your ear. No Q-tip, okay?
Okay.
And if you put drops in, you don't use a Q-tip after that, the drops will make it so the wax just comes out,
Okay.
okay?
Yep.
Thank you.
Welcome.
Good question. Thanks, Tommy. Okay, Kyle, where did you go? Oh no. Do you see him, Tyler? Did he leave?
There we go.
Okay.
There you are.
Hi, Kyle.
Where's Kyle?
It's kind of in the dark, but he's there.
I see Kyle. Hi.
Hi. I have a question that I am a Special Olympic athlete, one of the athlete leadership. I also went to the World Game in LA.
I'm sorry, I didn't hear you. What was your question?
I have a question about hearing. Are we allowed to do earwax in your, like the cotton in your ear?
The cotton, are you asking about the cotton from the Q-tip?
Yeah.
Yeah, that gets in your ear and mixes with the wax, and then it's very hard to get out. So that's why you don't use Q-tips.
That's all the question I have.
Okay, thank you. I hope I answered your question.
Thanks, Kyle. Okay, I think we have Michelle, go ahead.
I was wondering, where in Southern California did you work, and do you ever work down there anymore?
So I did the summer games, healthy hearing, and it was at Cal State Long Beach. And sometimes I go down there. Sometimes I go down there to train other people, but they have their own clinical director that does events.
Okay.
Thank you.
Thanks,
You're
Michelle.
welcome.
All right, who else? Let's see. Okay, Stephanie Ashby. Hi, Stephanie.
Hi.
Hi, Stephanie.
No feel well.
Oh, you don't? What's the matter?
Allergies.
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 Oh, allergies. Oh, I know. They're bad. It's because of all the wind. Do you have medicine for it?
No.
Who do you live with?
I also know. My house, Singapore.
Your house? Maybe someone can get some medicine for you at the pharmacy.
Doctor.
All right.
Okay.
Feel better,
Thanks,
Stephanie.
Yep. All right, Tyler, can you see who's next? I can't really.
Yeah, well, there's some good questions in the chat. Speaking of allergies, doctor, so someone had a question about do can allergies cause ear congestion?
Yes, allergies can definitely cause ear congestion because the inside of your ear, your nose, and the back of your throat are all connected. So when you get congestion in your nose, that can go in your ears. So yes, and you can get a hearing loss from that. But once that congestion or that fluid goes away, your hearing should go back and be normal.
And then Lisa said her ears hurt when she goes on the plane, especially when she goes up and down. Do you have any suggestions for that? You can tell us why that happens. So I think that happens to everybody.
So the reason that your ears feel all that pressure and they feel like they want to pop is because the pressure on the outside and the pressure in your ear is different. So in order to make them the same, you can chew gum or you can suck on a hard candy, and that will help your ears pop sooner, so that pressure is the same and you won't feel that pain.
That's good. I know that's happens to a lot of people. I know, especially going up and down, you do the blow in your nose and
You probably don't want to do this too hard, because if you do, sometimes you can burst right through your eardrums. So that's why when you chew gum, your jaw moves and it forces, Stephanie, I see you doing that. And it forces your ears to pop.
Awesome. Thank you. Does anybody else have any questions?
Tyler, it looks like Tommy might have his hand raised. I don't know, maybe.
Who?
Tommy, Stephen, maybe not.
And
Tommy, do you have another question?
Steve.
No.
If not, Michelle, it looks like Michelle does.
All right, go ahead, Michelle. Thanks, Lindsay.
You're welcome.
I was kind of wondering, do you actually work at a doctor's office or anything that deals with hearing or anything, or a practice on your own? Or
no, I don't have a practice on my own. I work in a hospital in Walnut Creek.
Okay.
And I work with the doctors and the nurses that take care of sick kids.
Oh.
But I used to do hearing test. I used to do that, but not now.
Well, that's nice what you do.
Thank you.
You're welcome.
Thanks, Michelle.
You're welcome.
Okay. I think Christine has a question.
Good morning, Amanda.
Good morning. Hi,
How are you guys?
Christine.
Hi, how you guys doing today?
Good, how are you?
Good. I have a quick question for you, Doc. On this side of my ear, right in here, sometimes I have a pressure, but I have to come this far off my pillow to make it stop hurting.
Okay, how often are you wearing those earplugs?
Not all the time. I take them out when I'm done talking to my friends, but at night, when I'm sleeping at night, like in the middle of the night, it hurts right in here on the outside of my ear. There's like a lot of pressure.
Do you have any redness?
No, it just hurts like crazy.
It just hurts.
Yes.
It's hard for me to see here, but you may, from those earplugs, caused an irritation. You may want to give yourself a break from using those for a little bit and see if that helps.
Okay. Another question I have for you.
Okay.
When you have like dry wax all the way inside your ear, how is that to take that out? What do you use basically?
So you can go to the pharmacy
Mhm.
and ask the pharmacist for some drops, ear
Mhm.
drops.
Mhm.
And at night, before you go to sleep, you just put a few drops in. You
How many
don't
do you
have
think?
just a couple of drops should be
Okay.
fine.
Okay.
You don't put any cotton or anything in your ear. Those drops will stay in and
Okay.
get absorbed by the
Okay.
wax.
Okay.
In the morning, when you wake up, you
Uh-huh.
may see some red or brown on your pillow. That's
Uh-huh.
not blood. That's just the wax that's soft and has started to come out.
Okay.
Okay?
So how long have you been doing this for? How long have you been doing this ear thing?
Being an audiologist for 44 years.
Oh my goodness, that's a long time.
It is a long time.
But do you enjoy your job though?
I love my job. I
That's
love my
good.
job.
Well, thanks for the information.
And
Sure appreciate it.
welcome. You're welcome.
Have a good day.
Thank you. You too.
All right. Bye-bye.
Bye-bye.
Okay, it looks like there's two more. Pendle Care Home.
Hi.
Go ahead. Ask your
Hi.
Hi. How long has it been? I have a lot of ear infections. How do I get those?
How long do you have an ear infection?
Yeah, how long did you get ear infections? Like, how do you get them?
Yeah, you can have an ear infection for a while until you get some medicine from the doctor.
Okay, cause I don't have none, but I get a lot of itching in my ear.
Itching in your ear, that's probably because of dry skin or because of wax that's in there.
I went to the doctor and they took the wax out.
They did? Okay,
Yeah.
good. That should help.
Perfect. Thank you for your question. And then next is Riley. Where did he go? Riley, do you have a question to ask?
Yeah, I had a question about how long do you take care of your ear every day?
Say that again, Riley.
How do you keep your ears clean on a daily basis?
Just when you shower and you wash your hair, just let some of that warm shower water get in there and it will keep the wax nice and soft and it will come out by itself.
And I also wanted to tell you, I've been doing Special Olympics for 14 years.
Oh, good. Very good.
I look forward to getting back on the field soon, Amanda.
Perfect. Thank you, Riley. Okay, next is Yuka had a question. Oh, where'd she go? Oh, not there anymore. Oh, there she is. You want to unmute yourself? Yeah. There you go. Go ahead, ask your question.
My ear hurts.
Yeah. Do you have allergies?
Yeah.
Yeah. Do you take medicine for it?
Yes.
Yeah. The medicine for your allergies will help your ears. It's just going to take a little bit, okay?
Okay.
Okay. Make sure you throw that tissue away and wash your hands, okay?
Oh, okay.
Okay.
Juanita, I can't see. Amanda, can you unmute her? Please.
Juanita?
Yeah? There we go.
Hi,
Do you have a
Juanita.
question?
How you doing?
Good. How are you?
Good.
Good. Do you have a question?
Yeah, how do you be careful with your ears?
Don't put anything in your ears bigger than your elbow.
Okay.
And when you wear earphones, don't wear them really loud, okay?
Okay.
Okay.
Thank you.
You're welcome.
Thanks, Juanita. Okay, I had a question Beth, someone asks if their parents have hearing aids, do they need to be tested as well? Or does that individual need to get hearing tested as well?
Do your parents, do they wear hearing aids because they're older, or did they always wear hearing aids?
I believe it's because they're older, but
okay. So if your parents have hearing loss because of their age, because as they got older, their hearing got bad, then when you get older, you should have your hearing checked. Because if your parents have hearing loss, there's a good chance you'll have hearing loss when you get older. So you should get it checked. Yes.
Okay, wait, I'm gonna see if I can unmute her so she can ask. Hi, Christy, would you like to ask your question?
It's Angela, but
oh,
yeah,
hi, Ange.
she had her tooth taken out today, so she's unable to talk. So, but yeah, her parents are older. So what age should she start having her hearing tested to see if she needs them?
I would say if whatever age you are, if you notice that it's getting difficult for you to hear, go in and get tested.
Okay.
But I would probably start getting my hearing tested at 50.
Oops.
And
okay.
You can, when you come to the sporting event and there's healthy athletes or healthy hearing there, we can do that test for you.
Okay.
All right,
okay,
thanks,
you.
Ange and
Sure,
Christy.
no problem.
Okay. I think Kelvin, you might have a question. No? Yeah? Okay, can you unmute yourself, pal? What's up, Kelvin?
Hi, Doctor.
Hi.
Hey, how you doing, man?
Good, how are you?
How you doing? I'm great. I have a question. I was very hearing loss at the age of 3 to 6 years old. And I was been hearing loss like for most of my life. And I had a question for like, what is the best eardrop solution do you recommend to use for the eardrop? Like, I know when I take a shower and stuff, like using warm water, but like right before you go to bed or whatever, what's the best solution do you use for eardrop?
The name of the eardrop is called Debrox.
Mm-hmm.
Debrox. And you can get it at any pharmacy, CVS, Target. They also have the no-name brands that work just as well, and they're not as expensive.
Okay.
Okay.
If you use the earplugs, do you have to use it like if you go swimming? Do you have to use it like before you get in the pool? And then like what it can do get in the pool and like go under the water? It kind of like when I use one, it is like when I use one of them and the other to go out and under the water, it is like I know the liquid start to go to my ear. Like I'm have to trying to find the good earplugs to keep them on when I'm under the water.
So you want to know about swim plugs?
Yeah.
Okay, so you can get those made. You'd have to talk to your doctor about that because they can be custom made. Or again, you can go to the pharmacy and they have the little wax ones that you can put just in your ear to prevent the water from going in.
Okay. Appreciate it, Doc.
You're welcome.
Good question, Calvin. It looks like Amber has a question.
Hey, I have a question.
Sure.
So I heard you talk about music on the slideshow, and I was wondering, can loud music cause your ears to get to have bad hearing?
Yes.
Okay.
If you listen to loud music.
I do.
Yeah, but for long periods of time, gradually it will cause you to have hearing loss.
Ooh, I need that.
Okay, so you might notice that you listen to the loud noise, the loud music. And then when you don't listen anymore, you hear ringing in your ears. That's because you've started to damage the inner part of your hearing.
Ooh.
And it might get better, but then if you listen to the noise again, gradually over time, it's not going to get better anymore.
Okay.
Okay?
Okay. Thank you.
You're welcome.
Good question, Amber. Okay. All right. Does anybody else have any last questions before I? Oh, here, JJ. Is it okay to use swimmer's ear every day? I swim a lot and wash my hair. Water gets in my ears.
Yeah, it's okay as long as you shake your head and make sure that the water comes out, because if the water stays in there, you can get an infection from that. But if you have earplugs, you can wear your earplugs every day.
Perfect. Thank you. Okay. Sandra, I think you have your hand up again. These are good questions, guys.
For the eardrops, what kind of eardrops do you use for your ears?
Yeah, the name of the brand is Debrox, but if you go to the pharmacy and ask the pharmacist, they'll be able to help you get it, okay? You don't need a prescription, you can just buy it.
I can email the name of it to everybody after this session, if you, okay?
Okay.
Okay. Awesome. Okay, thanks, Sandra. I think Sophie has a question.
Hi, yeah. So when I was swimming, my dad and I would go swimming, and then that means I get out. We both have like one ear infection. I mean, not infection, but I mean like you start feeling like there's water in your ear, and it kind of like hurts a little bit for a little bit, and then you have to like, can you use just like warm water to get all of it, or yeah.
Yeah, you can use a little bit of warm water to get rid of the water from the pool, but you just want to make sure that all that water comes out of your ear. You don't want it just sitting in there.
Like when you're sitting up and you're bouncing
Yes,
out, getting it out, that kind of thing.
Exactly.
Great,
Yep.
thank you.
You're welcome.
It looks like Christine might have one more question. Go ahead,
Doc,
Christine.
I have a question for you, Doc.
Okay.
How long does it take if you go swimming or something, right? And you don't like tip your head over to wherever side the water is into? How long does that water stay in your ears?
Well, if it's deep enough and it gets trapped in there, it can stay in there for a long time.
Okay. So when is the best time to get the water out of your ear?
Right when you get out of the pool.
Okay.
Kind of shake your head and make sure that the water is out.
Okay, I got another question. Is it okay if you hit when you tip your head, is it okay if you go like this?
You can do that. You can do that a little. Yep, you can do that.
Okay, so I wanted to know. Thank you.
Yep, you're welcome.
Good question, Christine. I have the same issue. All right, let's see. Tyler, you want to do some questions? Who's your favorite Disney character?
Yeah, do we have time for that?
Yeah. Do you have time, Dr. Beth?
Yes, I do.
Awesome. All
My
right.
hand's shooting up.
I know, right? Everyone's
Right.
awake now.
Question of the day. First of all, those are a lot of great questions, a lot of great information. So thank you, Dr. Beth, and thank you all of you for some really great questions. I learned a lot, and hopefully we all learned a lot too.
Thank you for having me.
So the question of the day, as we always do, who is your favorite Disney character? can be a movie, it can be a show, it can be a cartoon. So I see Dr. Beth's hand going up there first. Go ahead.
Okay, ready? My favorite is Mickey Mouse because he has really big ears that he can hear better with.
Nice.
Tyler, what's
Also
your
a fan of Dumbo, probably, and some of the other.
Yeah.
Very good.
Tyler, who's your favorite?
Let's come back to me. Lindsay,
Oh,
you can
okay.
go pick somebody. I don't know. I didn't think about it.
Fine. Okay, let's go Pendle Home Care. All right, what's your favorite Disney character?
My favorite is Goofy.
Goofy? Oh, that's a classic. I love Goofy too. Nice one. All right, let's see. Oh, Michael LeBrock. Michael, who's yours?
Mickey Mouse because he was born on the same day as me.
Oh, nice.
He's
Really?
November 18th.
Oh, I didn't know that.
Yep.
November is a
Very
great
cool.
month. Thank you, Michael. All right, I'll pick one more. Let's go with Jay. Jay, who's yours?
My favorite Disney character is I like Easy from Descendants.
Oh, okay. I've never heard. That's
From
cool.
Descendants 3. And I like Easy because she's really good. And I love her hair and she designed all her clothes and stuff.
Awesome. I love it. All right. Tyler, you take it away.
All right. Who's got their hand up? Go ahead, Ellen.
My favorite character is Anna for the Frozen because she's beautiful and I wish I can like her.
Anna from Frozen.
Yeah.
Yeah, that's a good one. What's yours, Ed?
Okay, mine is Mickey Mouse.
Mickey Mouse. All right, a lot of Mickey Mouse. Fan of yours here today, Doctor. A lot of good ones in the chat too. So we see Mickey Mouse, Belle, Aladdin, Donald Duck, Goofy, Mickey Mouse, Minnie Mouse, Zendaya, Pluto, Mickey Mouse, Hannah Montana, all the princesses, Tarzan, Maurice, I like that one, Belle, Moana, Cheetah Girls, Mal, I don't know who Mal is, Christy, Angela, Mal, Star Wars, Buzz Lightyear, a lot of good ones there. Go ahead, Amber. What's your favorite? Who's your favorite?
Okay, Tyler. Hey, does Marvel count? Does Marvel count?
Marvel counts, yeah.
Spider-Man.
Spider-Man. Nice. That's a good one. Yeah, Marvel counts. Star Wars technically counts.
Yes.
Everything's busy.
Yay. I love,
ESPN counts.
I love Marvel. So.
Thanks, Amber. Spider-Man. That's a good one. Well, else, any other hands?
I'd like to pick someone. Yeah. Maurice. And then Matt, you pick some.
Okay. Okay. I know I already type Tarzan. Another one would
Why
be
Tarzan?
Tarzan.
Mm-hmm.
Because I think Disney did a good job creating the story about how he was raised.
What noise does he make when he's in the jungle?
Yeah, he makes a loud.
Awesome. Thanks, Maurice.
You're welcome.
Amanda?
Yes.
Yeah, I have another meeting I have to go to, so I'm
Okay.
gonna have to sign off.
All right. Well, I'm gonna unmute everybody so we can say thank you to Dr. Beth. But thank you guys so much for coming today.
Thank
hope
you.
You guys learned
Really good
something. So.
questions.
Thank
Questions.
you.